Hi, it's Defined Life Coaching, and I just finished running Inciting Autistic Wellness for Thriving Autistically, which is a week of free events run by NeuroKindred, tagged below. And I wanted to give you a mini version of the hour and a half that I talked about, which had to do with how do we consider autistic wellness through an intersectional feminist lens, particularly for women and non-binary people, and what do we do with these doctors and therapists and providers who are gaslighting and dismissing and misdiagnosing us. So first I wanted to mention that by non-binary people I mean people who are not wholly men or women and who fall under the trans umbrella, and by transgender people I mean people whose gender today is not the same as the gender with which they were raised. And of course there are also cisgender people whose gender today is the same as the gender with which they were raised. By feminism I mean, just simply exposing different forms of inequality in society and dismantling them. By intersectional I mean attending to the fact that people have multiple identities and belonging to different groups and therefore face a simultaneity of oppressions, which is when we call ourselves multiply marginalized. And so in order to apply like an intersectional feminist lens to autistic well-being, we also have to talk about what well-being is and how that's defined and how that really influences which resources we can rely on, and it also makes a difference in terms of who gets to name that we are well or unwell, and what that has to do with licensure and credentialing and expertise. And I'm of the mind, obviously, with all my clients and everyone that I educate around the world, that you are the expert on your own experience, and that a lot of the people that we give power over to, like doctors and psychiatrists and psychologists and social workers who gaslight us, are not the experts, and they're actually really poorly trained when it comes to people with uteruses and anything that our bodies may experience, particularly if we're later in life diagnosed because we have been misdiagnosed or dismissed with things like anxiety and depression and borderline personality disorder, which of course some of us have but not all of us, and instead we're autistic or ADHD or have ADHD or CPTSD or whatever else that falls under the umbrella of neurodivergence. And so the conversation is really about reclaiming that power and understanding you're an expert on your life, but also that, if you ever checked out the subreddits on autism or the TikTokers and whatever, like we all have a PhD worth of knowledge under our belt, more than some random doctor who's going to tell you it's because you're fat. Okay, so there's a lot that we can do in terms of not only taking that power back and knowing we're experts, but also understanding these systems as like racist and sexist and classist and ableist and fatphobic and transphobic by design, right? And therefore holding them accountable for the harms that they cause to multiply marginalized communities, and that the things you're struggling with are not like personal failures, they're actually public health failures and systemic failures. And that's really important in as far as shifting your perspective too, because it's not only that, hey, please do not dismiss me, I know what I'm talking about and the level of pain that I'm dealing with, but also just in general, the field of psychology has not had an intervention where it, apologized for the harms it has caused, like LGBTQ people or Black people or disabled people. And, in their continuing to push that autism needs a cure or that we need ABA or CBT is like the answer to everything, they're continuously enacting harm onto multiply marginalized communities. And so it feels as if they want a very clear demarcation between how they have credentials and therefore no more, whereas you have nothing and should be thankful for the very little and incorrect diagnoses you receive. And that's just not true. So when I work with my clients, in addition to empowering them and explaining how systemic oppression works and what that has to do with their health and well-being and mental illness, it's also about how to navigate the medical care system and therapists and all of that, like in a way where, sometimes you just don't have any choice and you have to like pretend you know nothing and they are everything to feed their like gargantuan ego, right? But I create specific scripts for people to use with their families and with their doctors and with their therapists to get what they need, right? Because ultimately I do not want to see you harmed. And if we continue the way we continue, which is to say pushing through burnout and full shutdown, then we're going to lose people like we do every day. These systems of oppression, the medical industrial complex, the psychiatric industrial complex, literally holds the power to determine life and death sometimes, and they shouldn't. They shouldn't because they're not the experts, because they don't know anything, particularly when it comes to people with uteruses, and how we need to talk about ADHD and PMDD and EDS and MCAS and POTS, and the people making these connections are us, not them, because there's no funding and there's no research and there's no precedent, and the scales and the questionnaires, whatever, right? So we don't need to swing this pendulum all the way to where we say anyone can say anything they want, but we can also hold these people accountable for their ignorance and their education being terribly poor when it comes to this, and their arrogance being the barrier between their being able to hear people who know more than them and who are more invested in figuring out what's going on with the puzzle that is their health, right? So I've already said plenty, but I want to reiterate that at some point in your 30s and 40s and 50s, as you come to understand your power and you come to understand what's true about you that's been undiagnosed and like unrealized, you develop a certain stance, right? And once you educate yourself, you can develop a lot of knowledge too that you can then use to fight back against oppressive systems, within reason, because again, a lot of us are constrained by like just having access to one doctor or having no access to doctors. So these are larger problems that we all need to collectively address and confront, because it's an issue of public health, it's an issue of community. Like, you cannot outthink your way out of autism anymore that you can outthink yourself out of ableism just by yourself, because these are structural issues. We need structural solutions, and we need collective and community organizing, right, to like kind of not be the lone voice with this doctor or whatever. But that's why I also love now being in a position of being a patient advocate, or someone who shows up to your doctor's appointments just on Zoom, or shows up to your dissertation committee meeting, or shows up to your conversation with your mother or whatever, just to say, actually, what you're doing is gaslighting this person. And what they're saying is very commonplace for millions of people. And we have the lived experience and the data and whatever art to, back our position up. And you have nothing to back up your position other than bigotry, other than ignorance. And we're not going to stand for it anymore. So in any case, if you need my support and you want to work with me, my consults are free. There are sliding scales and payment plans. Please go to the Schminken My Schmio or into my DMs, and we can do a 30 to 45 minute consult for free and talk about anything and everything that you need. And you certainly do not have to work with me, but you are not alone out there.